Guess what? Instagram may be lying to you about needing a breast lift. The pencil test is not always accurate to determine whether or not you need a breast lift. Many patients have deflation and not true droop to their breast and could still place a pencil under their breast. Many of these patients can be treated with a breast augmentation without a lift to achieve great results. For those patients that are deflated, the implant reinflates the breast, therefore giving a youthful look and correcting the excess skin. For those patients that do have true droop or excess skin that can't be corrected with an implant, the reason is that skin needs to be removed. Even if you place an implant, your nipple position will still be lower than the apex of the breast implant. Many patients in this situation also ask, well, can I just do a breast lift? While a breast lift can reposition your nipple, it does not increase the volume of your breast. So many patients who have deflation and droop need an implant to correct deflation, as well as a breast lift to correct droop. The best way to determine this is not with a pencil. It's by visiting a board-certified plastic surgeon who does a lot of breast surgery and can give you an accurate idea of whether or not they think you will need a breast lift or you would be okay with just an implant. Please reach out to us with any further questions. You can call, text, or email us, but don't rely on the pencil, rely on a plastic surgeon.